COVID-19 has touched all corners of the world. When we thought we were getting free from COVID-19, Omicron emerged. Since it emerged in mid-November, Omicron has raced across the globe like fire. Though it has milder symptoms same as flu, the World Health Organization has warned that Omicron cannot be dismissed as a common cold or a mild disease. There are reasons to worry about it. People with diabetes and heart disease can face severe complications. Due to the previous lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. So if you have any questions you would like to ask them, do send them to us via WhatsApp on +91 9167 666 941. Yes, that's the number for you to send us your questions for our experts. Do please also send us your name and your location. Let me introduce our doctors, our experts today. We have with us Dr. Vinayaswamy P M, MBBS, MD Consultant Diabetologist, Asha Diagnostics, Sri Guruba Basaveshwa, Diabetic Care and Research Center, Karnataka, and Dr. Srinivas Kudva, MD, DNB Cardiology, Consultant Interventional Cardiologist, Healing Hearts, the Angioplasty and Valve Experts, Breach Candy Hospital, Mumbai. Thank you so much, doctors, for joining us today. I would like to start with you, Dr. Vinayaswamy. Some people are already suffering from the long COVID effect. How susceptible are these people to Omicron, and what extra care should be taken specifically for people with comorbid conditions?
Yeah, first and foremost, let us know what exactly is long COVID.
Yes.
So we say long COVID when a person who has recovered from COVID but still is having some symptoms persisting. The commonest symptoms that persist are easy fatigability, shortness of breath, and decreased concentration and rainfall. There are other symptoms as well, like chest pain, anxiety, depression. These also can happen. So whenever these symptoms persist, even after recovery, we call that a person is having long COVID. So is there any treatment for long COVID? Exactly, there is no specific treatment for long COVID, but at the same time, they should not ignore any symptom thinking that it has long COVID, and they should consult their primary physician for these symptoms. So what is the extra precautions these people should take to avoid Omicron? So it is similar to any other person. There is no special precaution for a person with long COVID and without long COVID.
Okay.
Long COVID person, first and foremost, is vaccination. The commonest question that arises in the mind of these people with long COVID is, since I'm having these symptoms, should I take a vaccination or not?
Okay.
Vaccination is a must. They should take vaccination because in the previous wave, we have seen in practically those who got vaccinated, the admissions were very, very few.
Yeah.
And those who got admitted with vaccination, the outcome was tremendously good. There was hardly any mortality in those patients who had vaccination. So vaccination has to be very much stressed because there is a possibility that since I'm having symptoms, am I totally cured or not cured? Should I take vaccination or not? They should take vaccination.
Okay.
And then like other COVID protocol following, like masking, physical distancing, hand washing, these has to be followed.
So vaccination is, of course, key, not to take even Omicron lightly. I think what you rightly said, and of course, maintaining all COVID protocol, what you just rightly said, washing our hands, maintaining social distancing, and of course, wearing the right mask and wearing it correctly. Dr. Kudva, we have a WhatsApp question from one of our viewers, and he or she would like to know that earlier the gap between the first and the second vaccination was 2 weeks, and then it changed to 12 weeks. So what is the correct gap between, the vaccination now?
A very good evening. So that's an excellent question. And as COVID evolves, our understanding of COVID also evolves. So initially, we all frontline health workers were, when we were vaccinated, there was a gap of 4 weeks between our doses.
Yes.
But now our research tells us that it's better that we take the two vaccines with 12 to 16 weeks apart. That is in India. Now there is also a third precautionary dose which is there, which is ideally taken 9 to 12 months later on, which has been told for frontline workers and people with comorbid conditions, people who are at high risk for complications if they develop COVID. So in order for such people to get a better antibody response, the precautionary dose has been prescribed.
Okay. Okay, no, thank you for explaining that. Another question also which we have, Dr. Vinayaswamy, that's also through WhatsApp. A viewer wants to know, what could be the reason for vitamin B12 levels reducing in a diabetic over a period of time?
Yeah. Vitamin B12, first let us know what exactly is vitamin B12. Vitamin B12 is a very important micronutrient that is very, very important for proper functioning of the hemopoietic system, nervous system, as well as the cardiovascular system. If there is deficiency in this vitamin B12, then the red blood cells become swollen, what we call it as macrocytic anemia, and there can be anemia because of vitamin B12 deficiency. And when it affects the nervous system, there can be decreased memory, dementia, and peripheral neuropathy, wherein the patient will experience pins and needles like sensation. They can even have dementia and delirium. So, vitamin B12 deficiency is commonly due to 3 reasons. One is diet, 2 is metformin, 3 is autoimmune disorder.
Okay.
So, a study was done by Dr. Yagnik, wherein he looked into 441 healthy adults and checked for vitamin B12 deficiency. Surprisingly, 67% of the population had vitamin B12 deficiency, even though they were not having any other illnesses. And only the common denominator was all of them were vegetarians. So, vegetarian diet is very, very poor in vitamin B12.
Okay.
So, vegetarians have vitamin B12 deficiency. And 2, metformin. Metformin being a wonderful drug for diabetics, it brings down the blood sugar robustly, and it is weight neutral. The hypoglycemic episodes are minimal. With all these things, it also brings down the vitamin B12. There has been a study done which shows that there is at least 25% reduction in the vitamin B12 after 5 to 10 years of taking metformin. So metformin is other culprit. The third one is autoimmunity.
Yes.
In type 1 diabetics, which is due to autoimmunity, there is atrophic gastritis, chronic atrophic gastritis, what we call. So the absorption of vitamin B12 is hampered. As a result, also they will have vitamin B12 deficiency.
Okay.
So these 3 are the commonest causes. It can be identified by annual screening. Once we identify that they have got vitamin B12 deficiency, it can be easily treated by giving either oral vitamin B12 or injecting, even intranasal. So
I think
the
it's
main
important.
thing is,
I think you put it out really well, Doctor, because it's important for us to know, and you've given the 3 reasons, you explained it really well, whether it's autoimmune or whether you're on the medication, and for vegetarians. So one definitely needs to keep a check and, of course, have foods which are rich in vitamin B12. Dr. Kudva, people often take high blood pressure lightly, especially now during the pandemic. There is a surge in hypertension patients, and what are the possible complications of it?
So hypertension is known as a silent killer, and it is also a disease of paradoxes, because hypertension is easy to diagnose and easy to treat, and we have multiple medications to treat it, and yet 70% of the people who are known hypertensives have poorly controlled blood pressures. So that is where the paradox is. And a silent killer that it is, it can cause cerebrovascular accidents or strokes. It can cause coronary artery disease. It can cause congestive heart failure. It can cause retinopathy and blindness. It can cause kidney failure and it can cause peripheral arterial disease because the arteries, the blood vessels of the body lose their elasticity. So hypertension should not be taken lightly. That one pinch of salt that you take extra will harm your body. So hypertension should be regularly checked. Your blood pressure should be regularly checked and regularly controlled.
Yes.
We are used to using electronic machines at home, which do have their own drawbacks and fallacies. So please go to your primary healthcare provider and get your blood pressure checked on a regular basis with the mercury machine or a sphygmomanometer, which checks it more correctly rather than the automated machines.
Okay. So I think that is a very important point because people do take it lightly. They're checking it at home and that might not be accurate. So one must go to their doctors regularly, keep a check. And like what you said, it is a silent killer, but easy to diagnose, easy to treat. But sometimes, yes, we do need to take it more seriously now. Dr. Vinayaswamy, people talk about uncontrolled blood sugar. What exactly is meant by uncontrolled blood sugars? And when should a person with diabetes start to worry about his or her uncontrolled blood sugar levels?
Yeah. So first and foremost, let the person need not worry about uncontrolled blood sugar. If there is uncontrolled blood sugar, there are ways and means to control blood sugar. 1. 2. We say that someone has got uncontrolled blood sugar if his HbA is more than 7, or he has very high fasting blood sugar and postprandial blood sugar. So, but now in this COVID pandemic, what we have observed is once the patient develops this acute lower respiratory tract infection, and they are on some drugs at times steroids may have to be given, and even just because of the COVID itself, the blood sugar can spike up very high to very high levels. So the only way to have a controlled blood glucose is frequent monitoring. If the patient is at home isolation, they have to be frequently, they have to keep on checking their blood glucose frequently and see that their blood glucose is in the range, is less than 200 all the way. So this is about home. If the person is admitted to hospital, anyway, the doctors will control and keep the blood glucose within 200 milligrams of 200 milligrams per deciliter.
Okay.
Even when the person has got these osmotic symptoms like extreme fatigability, easy fatigability, tiredness, excessive uriness, polyuria, thirst, that also tells that they have to check for the blood glucose. If it is found to be high, then they have to consult their primary physician.
Okay, so I think on that note, it's important not to worry, control your sugar levels, and it's very doable like what you said. That's a good thing to hear. So thank you. On that note, we're going to be taking a very short break. So for our viewers, if you have any questions you would like to ask our experts, please send them to us via WhatsApp on +91 9167 666 941. Yes, that's the number to send us your questions for our experts, and also to send us your name and your location. So we'll be right back after this short break. Welcome back. You're watching Beat Diabetes Myths and Facts. Dr. Kudva, you probably wouldn't ignore a pain in your chest, but people very often dismiss pain in legs as there can be multiple reasons behind a pain in the leg. And these reasons, one presumes that they're not serious. Can heart problems really cause pain in the legs? Should one be serious about that?
So in the same way how blockages in the heart or coronary artery disease, patients do have chest pain.
Okay.
In the same way, if they do have peripheral arterial disease, they do complain of spasms, muscle cramps of the legs. So this is something that we all need to watch for. This is called as peripheral arterial disease. And if you have uncontrolled hypertension, uncontrolled diabetes, if you are morbidly obese, if you have other risk factors such as smoking or poor genetics, then you are more prone to peripheral arterial disease. And if you have peripheral arterial disease, there is a 90% probability that you will also have heart blockages or coronary artery disease.
Okay.
I don't mean to sound dramatic, but I tell all my patients, if you do have uncontrolled blood pressure and uncontrolled diabetes, you have to take it as seriously as cancer.
Okay.
Because it affects multiple organs at the same time. And if you start developing problems and if you start developing symptoms, that means the damage has already occurred. So it's always better to get checked regularly and prevent complications.
Yes.
So primordial prevention is the best form of prevention, even before primary. So you prevent the complications before they occur.
Yeah, I think that's a very key point. Let's not wait for the problem to come, prevent it before a complication really rises. Dr. Vinayaswamy, if you're living with type 1 or type 2 diabetes, continuous glucose monitoring can help you make more informed treatment decisions that can lead to better glycemic control. So at which stage of diabetes is it to be considered for use, and is it necessary for all people with diabetes?
Yeah, this continuous glucose monitoring, in fact, it is a boon.
Okay.
It is a fantastic device that is available, especially for our Indian patients. It is available since past 5-6 years, I believe. We have got two types of devices here in India. One, it works for 7 days, and the other one works for 14 days. Here, this device continuously monitors the glucose almost every 15 minutes. So we have got recordings for 24 hours, every 15 minutes. The commonest question that arises in a person whenever he is identified as diabetic is, what should I eat and what should I not? So this question, especially it gets complicated when their neighbors start telling him, this is what you eat, this is what you should not eat. So for those people, once they insert this device, continuous glucose monitoring, they can themselves see graphically what increases their blood glucose, what does not increase their blood glucose. And also, they can monitor over a period of 14 days and find out what exact lifestyle modification can improve their glucose levels. So, all in all, it is a very fantastic tool, especially for the newly detected ones.
Okay.
Now, there are another set of people who are there long-standing diabetics.
Patients.
Sometimes we get very high blood glucose in the morning. Usually it appears as a response to, reactionary response to hypoglycemia in the night. So such people go undetected. If they are on continuous glucose monitoring, we can identify that they have had an hypoglycemia in the night time. And that is, the hyperglycemia in the morning is a response to that hypoglycemia.
Okay.
So instead of increasing the dose of OH or insulin, we can just fine-tune the insulin dose or OH dose, and we can adjust the diet.
So all in all, like you rightly said that the device is useful and one could really use it, and it is good to know what your sugar levels are, and it helps you maintain it as well.
Yeah.
Okay, so
exactly.
Dr. Kudva, just moving ahead, we've been talking about the heart, we've been talking about diabetes, but smoking is one of the major risk factors for heart disease. If a person who is a long-term smoker stops smoking now, will his heart attack risk be reduced?
Okay, so there is absolutely nothing good that comes from smoking.
Yes.
My youngest patient who got a heart attack was 17 years. So smoking is horrible. And once you stop smoking, immediately your body starts healing. There are MRI studies which show that with every puff, your body gets affected.
Okay.
Once you decide to quit smoking, within an hour, the body starts showing improvement. It takes almost a year for your risk of heart attack to come down to half after you quit smoking. After 5 years, your blood vessels begin to relax. The stiffness that has been caused because of smoking actually starts relaxing. And only after 15 years of quitting smoking will you be at the same level of risk as compared to someone who has never smoked.
Okay.
So smoking is something that is purely hazardous to your body, your heart. So please quit it as soon as possible. It's even a single puff affects ciliary motility.
Yeah.
So there is nothing good that comes from it.
In fact,
So stop it as soon as possible.
stop it as soon as you can. And I think the good thing here is like what you've explained really well, doctor, that stop it, but even when you stop it, it's never too late. So, you know, one shouldn't think that, oh, I've been a smoker, so it's never too late. I think that's the way to look at it. Dr. Vinayaswamy, regular physical exercise is a major part of diabetes management. When is it the best time to exercise for diabetes patients, and what type of exercise are safe for people with diabetes?
Yeah. First and foremost, exercise is as important as your medications. Exercise, in fact, is the first line after the diet. So there is no such thing that the person has to do exercise during this hour or during that hour. Whenever they find time, they should be doing the exercise. The recommendation is at least they should be doing 150 minutes of exercise in a week, or 30 minutes of exercise 5 days a week. That is the recommendation. So what type of exercise is the question? Anyone who has not exercised all these days, the best way to start is you should start walking, and then they can slowly increase to jogging. And also they should include resistance exercises at least twice a week, which builds up the muscle mass, thereby decreasing the insulin resistance.
Okay.
So now the other question that comes frequently is how fast or what is the speed with which I should walk. For that, the recommendation has been 80% of your maximum heart rate has to be achieved for at least 10-15. That will be 220 minus age is the maximum heart rate.
Okay.
For example, if a person is aged 50 years, so his maximum heart rate will be around 130. 220.
Okay, so I think it's important that the whole thing is that one should exercise. There is no time to exercise. Of course, one has to see what goes with their body. So on that note, we would like to thank our viewers for sending in your questions. And thank you so much, doctors, for sharing your expertise with us. So for our viewers, if you all have any questions which you would like to ask our experts, please send them to us via WhatsApp on +91 91 67 666 941. Yes, that's the number to send us your questions for our experts. Also, do not forget to send us your name and your location. So thank you all so much for watching.